Welcome to Module 1 of our Behavior Therapy course. Today, we'll explore the foundations of behavior therapy and dive deep into classical conditioning principles. So, what exactly is behavior therapy? At its core, behavior therapy is a systematic, evidence based approach to changing maladaptive behaviors through learning principles. The fundamental philosophy is beautifully simple yet powerful. Behavior is learned, and what has been learned cannot be unlearned. Unlike any other psychoanalytical approaches that focus on uncovering unconscious conflicts or past traumas, behavior therapy deals directly with the present behavior. We are not asking, why did this develop? But rather, what's maintaining this behavior now and how can we change it? This present focused, action oriented approach makes behavior therapy highly practical and measurable. Let us look at how behavior therapy developed. The story begins with Ivan Pavlov, a Russian psychologist who, in the 1900s, made an accidental discovery that would revolutionize psychology. While studying digestion in dogs, he noticed they began salivating before even food was presented, just at the sound of the lab assistant's footsteps. This led him to discover classical conditioning. In 1920, John Watson conducted the controversial Little Albert experiment, demonstrating that fears could be conditioned in humans. Then came B.F. Skinner in the 1930s and 40s, who developed operant conditioning and showed how consequences shape behavior. The 1950s brought Joseph Wolf's systematic desensitization, a breakthrough treatment for phobias. Albert Bandura added social learning theory in the 1960s, and since the 1980s, we've seen integration with cognitive therapy, creating what we now call cognitive behavioral therapy. Now, let us understand classical conditioning in detail. Classical conditioning is learning through association. When two stimuli are repeatedly paired together, we learn to respond to one the way we naturally respond to the other. Let me explain the key terms using Pavlov's famous experiment. An unconditioned stimuli is something that naturally, automatically triggers a response without any learning. For Pavlov's dogs, this was food. The unconditioned response is the natural response to that stimulus, salivation when food is presented. Pavlov introduced a neutral stimulus, a bell, which initially meant nothing to the dogs. He rang the bell right before presenting food repeatedly. After many pairings, something remarkable happened. The bell alone started making the dogs salivate. The bell had become a conditioned stimulus, and the salivation in response to the bell was now a conditioned response. The dogs had learned to associate the bell with food. The Little Albert experiment demonstrated this with disturbing clarity. Watson took an 11-month-old infant named Albert and paired a white rat with a loud, frightening noise. After just 7 pairings, little Albert showed fear of the rat alone. Worse, this fear generalized. He became afraid of anything furry, like rabbits, dogs, even a Santa Claus mask. This experiment, while ethically problematic by today's standards, proved that fears could be conditioned and would generalize to similar stimuli. Understanding the principles of classical conditioning is crucial for therapy. First, acquisition. This is the learning phase where the conditioned stimulus and the unconditioned stimulus are paired repeatedly. The more the pairings, the stronger the association. Extinction is when we present the conditioned stimulus without the unconditioned stimulus and the conditioned response gradually weakens. If we keep ringing the bell but never give food, eventually the dog stops salivating to the bell. This is the basis for exposure therapy. But here's something interesting: spontaneous recovery. Even after extinction, if we wait a while and present the conditioned stimulus again, the conditioned response sometimes returns. Usually, though weaker, this explains why phobias can sometimes resurface after successful treatment. Generalization means the conditioned response occurs to stimuli similar to the original conditioned stimulus, like little Albert fearing all furry objects. Discrimination is the opposite, learning to distinguish between stimuli, like a dog learning that only a specific bell tone means food. Now, let us discuss systematic desensitization, one of the most effective behavioral treatments ever developed. Joseph Wolpe created this technique based on a principle called reciprocal inhibition. That means you cannot be relaxed and anxious at the same time. These states are incompatible. This treatment has three components. First, we teach the client progressive muscle relaxation, a skill they can use to induce deep relaxation. Second, we create an anxiety hierarchy, a ranked list of 8 to 12 situations related to their fear from least to most anxiety provoking. Third, we gradually expose them to each item while they are developing or deeply relaxed. Let me give you a concrete example: treating spider phobia. We would start by usually having the client practice relaxation until they are proficient. Then we would create a hierarchy. At the bottom, maybe 10 out of 100 anxiety level might be simply looking at the word spider written on a paper. Next level might be viewing a cartoon spider, that is 20 out of 100. And then gradually photographs, videographs, a spider in a closed container far away, and last, then closer touching the container, and finally at the top of hierarchy, allowing a spider to crawl near them. We start with the lowest item. Once the client can remain relaxed while imagining or experiencing the situation, we move to the next level. The key is they're never overwhelmed, we only progress when they're comfortable. Flooding. Flooding takes the opposite approach. Instead of gradual exposure, we immediately expose the person to their maximum fear stimulus and keep them there until their anxiety naturally subsides. For someone with elevator phobia, we might have them ride elevators for 2 hours straight. But why does this work? The anxiety response cannot be sustained indefinitely. Eventually, the body exhausts this fear response and extinction occurs. It's more efficient than systematic desensitization, but also more distressing. So, we carefully consider which approach is appropriate for each client based on their individualistic needs. Aversion therapy works differently. It creates negative associations with unwanted behaviors. The classic example is using disulfiram for alcohol addiction. When someone taking disulfiram drinks alcohol, they become violently ill. The alcohol then becomes associated with sickness, creating an aversion. However, aversion therapy raises ethical concerns and has limited long term effectiveness because the aversion often doesn't generalize outside the treatment settings. Today, exposure based treatments have evolved significantly. For post traumatic stress disorder, we use prolonged exposure therapy, where clients repeatedly recounter their traumatic experience in a safe environment until it loses its emotional intensity. For OCD, that is obsessive compulsive disorders, exposure and responsive prevention is the gold standard. Someone with contamination fears might touch a contaminated object and then resist washing their hands. This breaks the cycle of obsession and compulsion. Virtual reality has revolutionized exposure therapy. We can now treat fear of flying without leaving the therapist's office using realistic VR virtual reality simulations. This is especially useful for phobias that are difficult or expensive to arrange in real life. These modern applications all rest on the classical conditioning principles discovered over a century ago. They're just more sophisticated in their delivery. Let me share a real case that illustrates these principles. A 28-year-old marketing professional came to therapy with severe public speaking anxiety. Her fear developed after an embarrassing presentation where she froze and could not continue. That experience, the unconditioned stimulus, created intense anxiety, that is, the unconditioned response. Now, even though the thought of presenting triggered the same anxiety, the presentation setting had become a conditioned stimulus for her. We used systematic desensitization. First, I taught her progressive muscle relaxation, which she practiced daily for 2 weeks. Then, we created a hierarchy starting with imagining positive comments about presentations, gradually building to actually presenting to large groups. Over 10 weeks, we worked through each level. She had achieved deep relaxation, then I had her vividly imagine the scenario. We only moved forward when she could maintain relaxation. The final steps involved real presentations, first to me alone, then to trusted colleagues, then to small meetings, and finally to the full company meeting. The outcome was excellent. She successfully presented at the company wide meeting with minimal anxiety, and the skills generalized to other challenging situations. Let's summarize the key points from this module. Behavior therapy is fundamentally about observable, measurable change based on learning principles. It's evidence based, practical, and focused on the present rather than the past. Classical conditioning explains how many fears, phobias, and emotional responses develop through association. A neutral stimulus becomes associated with something that naturally triggers a response, and we learn to respond to the neutral stimulus in the same way. The therapeutic applications are powerful. Systematic desensitization uses gradual exposure combined with relaxation to help people overcome fears. Flooding uses immediate, intense exposure for faster results. Both rely on the principle of extinction, which is repeatedly experiencing the feared stimulus without the expected negative outcome weakens the fear response. These aren't just theoretical concepts, they are evidence based treatments with decades of research supporting their effectiveness. Studies consistently show that exposure based treatments have success rates of 70 to 90% for phobias and anxiety disorders. As you move forward in studying behavior therapy, remember these fundamental and foundational principles. Classical conditioning is just one piece of the puzzle. In our next module, we'll explore operant conditioning and how consequences shape behavior. Thank you for your attention, and I'll see you in Module 2.